And this is the reason why today you see just about every screen, every computer, every cell phone. I mean, there's not one that's outside of the new daylight computer screen that is non-blue lit. And the reason why is blue light has been shown to destroy melatonin, and it's been to destroy the dopamine reward tracks in your brain so that it makes you low agency, makes you not question, makes you more compliant, more pliable for, how shall we say, government program.
What if I told you that your light bulbs and late night screen time are silently sabotaging your health? Yes, this is not clickbait. World-renowned neurosurgeon Dr. Jack Kruse made headlines and enemies when he exposed the shocking dangers of artificial blue light. His controversial findings didn't just shake up the medical world, they got him banned. He definitely uncovered something chilling. But what was it? In this video, we'll reveal how his research connects blue light to chronic disease, aging, and even mental health struggles. Stick around to discover how his revolutionary insights could protect your health, defy conventional science, and change the way you see light forever. If you didn't know about Dr. Jack Kruse before, he is an accomplished neurosurgeon with decades of experience. He has spent his career studying the human brain and spine, performing numerous surgeries to help people with serious health problems. Dr. Kruse became well known in the medical field for his expertise in complex surgeries and his ability to treat conditions that other doctors couldn't. He's also held positions at prestigious medical institutions, which added to his credibility as a respected doctor. However, beyond surgery, Dr. Kruse is mostly known for his groundbreaking and controversial research in fields like nutrition, biology, and health optimization. His journey into controversial research began when he started exploring how simple things like lifestyle factors, light exposure, temperature, and diet could influence the brain and overall health. Dr. Kruse's most notable work in this area is his study of how the body interacts with the Earth's magnetic field and light. He believes that the modern lifestyle, with all its technology and artificial lighting, is damaging our health in ways we don't fully understand. For example, he claims that poor sleep and constant exposure to artificial light at night can harm the brain, increase stress, and even raise the risk of diseases like cancer.
That gambling is an addiction. I think everybody knows that, but they don't realize it's not the addiction to money. It's actually the addiction through light. And that's actually the most successful addiction you can have. Why? Because it's easily controllable. And actually, if you talk about other addictions like the food, porn, or the one I like to talk a little bit about is mental illness, depression that we see in a lot of, rock and roll dudes. They don't realize that one of the metabolites that's made from the cleaved products of palm seed that is only turned on by UV light means you need to turn UV light off in the environment that the mammal's in that you're trying to control. One of those cleaved products is called beta endorphin. And beta endorphin is something that's liberated both through exercise, but also through UV light. What most of the exercise meatheads don't know is exercise-induced biophoton release, which stimulates beta endorphin. Beta endorphin is a natural opiate. So in people that live their lives under the blue light, the non-native EMF, tech abuse, transhumanist ideas, the technocracy, or, they're Jimi Hendrix, Kurt Cobain, Chester Benningfield, whoever you want to plug in. This is the reason why they're all opiate addicted. And remember, opiate addiction through light is how we got to where we are.
He argues that our bodies are not designed to live in a world where we are constantly surrounded by artificial lights, and that this disrupts our biological clocks. But this research led to some pushback from the medical community. Many scientists were skeptical about his theories, as they went against established ideas about health. Some even accused Dr. Kruse of making claims without sufficient scientific evidence to support them. Despite the criticism, he continued to share his findings with the public through blogs, lectures, and books. But exactly what's the connection between artificial blue lights and health? Artificial blue light is a type of light that comes from screens like those on phones, computers, and TVs. It's also in lights such as LEDs that we use in our homes and street lights. This blue light is actually just a part of the white light we see, but it has higher energy and can be more harmful than other colors of light.
Two types of blue light hazard that I want to go over with you. One is the rhodopsin mediated, and then there's the lipofuscin mediated. So when blue light comes in, what happens? Retinol separates from the receptor, the opsin protein, then has to be recycled. What happens when there's too much high energy blue? It cannot recycle fast enough, so vitamin A drops. That's why vitamin A is always linked, not causal, but it's always linked in some way, a correlative link to obesity and most mitochondrial diseases. That's the key. And that's the take home that I want you guys to understand. And the reason why blue is an issue, vitamin A is yellow in color. It's a complementary color. So what does that mean? That means that blue light in AM sunlight is incredibly important to your vitamin A cycle. That's the reason why it's important, because blue light's what makes vitamin A in your brain. Here's the action spectrum for the blue light hazard. You can see, starts at 400, but the peak is 435 to 465. That's why all my glasses block that. That's the reason why I think Dave is a great guy. The fact that 2 years in a row, he bought everybody the blue blocking glasses. The sad part is, looking out in this audience, not too many of you are wearing them.
Blue light is everywhere in modern life because most of our devices and lighting systems use it. In fact, we spend so much time looking at screens and under LED lights that we are constantly exposed to it. But what makes blue light dangerous? Well, our bodies have a natural system called the circadian rhythm, which is like an internal clock that helps us know when it's time to sleep and when it's time to wake up. This system relies on natural sunlight to know when to start winding down for bed. The problem with blue light is that it tricks our brains into thinking it's daytime, which can confuse our internal clock. When we use our phones or computers late at night, the blue light keeps us awake longer because it blocks the production of a sleep hormone called melatonin. This makes it harder to fall asleep and causes us to feel tired the next day. Studies show that too much blue light exposure can also lead to long-term health problems. For example, research suggests it can contribute to eye strain, headaches, and even damage to the cells in our eyes. In fact, the World Health Organization has said that blue light may even increase the risk of macular degeneration, which is an eye disease that can lead to blindness. And if that's not enough, listen to this.
It was a paper written in the 1940s and 50s about babies that were born with jaundice, who we used to use UV light to get rid of the jaundice. It was very effective.
I was one of those.
And
I was a jaundice light.
That paper led dermatologists to go after UV light because UV light began to be studied, but studied outside of the normal spectrum. Remember, UV light on Earth is never present without the other 6 colors or frequencies. But every single study that's been done in the dermatology literature since the retroretinal hyperplasia study on kids that were jaundiced has been done with UVA or UVB light subtracted from the other 6. Turns out the antidote for the other ones are the other 6 lights, but dermatology has effectively never told you that. Now, if you go back to the retroretinal hyperplasia paper, dermatology was like a no-name specialty at that time.
Over time, if we don't take care of how much blue light we're exposed to, it can really hurt our vision and overall health, like obesity. When we spend too much time in artificial light, especially in the evening, it can confuse our internal clocks. This makes our metabolism slower and can cause weight gain. Studies have shown that artificial light messes up the release of important hormones that help us stay healthy, like melatonin, which helps us sleep. When we don't get enough good sleep, our body can start to store fat instead of burning it for energy. But what's even more surprising is that the lack of sleep caused by blue light exposure can lead to weight gain. A study found that people exposed to blue light late at night were more likely to eat unhealthy foods like junk food. This happens because when we're tired, our body craves sugary and fatty foods to get a quick boost of energy. This is why some studies show that people who spend more time on their phones or watching TV late at night tend to weigh more than those who don't. In fact, one study revealed that people who use screens for more than 3 hours a day have a significantly higher risk of being overweight or obese. So, the next time you're on your phone late at night, remember that it might be affecting more than just your eyes. It could also be impacting your body's ability to stay healthy. Now, imagine your body is like a finely tuned machine, with each cell working hard to keep you healthy. But what if something outside this machine was actively damaging it? One of these harmful forces is artificial light. When you're exposed to artificial light, especially at night, your cells experience stress known as oxidative stress, which can cause them to age faster. Scientific studies show that excessive artificial light can lead to damage inside the cells, accelerating aging and increasing the risk of diseases like heart problems or cancer. One shocking fact is that people who are exposed to significant artificial light at night tend to get sick more often and feel constantly fatigued, even if they sleep enough. But that's not all. Over time, this can cause hormone imbalances, leading to weight gain, stress, and mood disorders. One surprising study found that people who don't get enough sleep due to light disruption have a 50% higher risk of developing heart disease. Because, after all, everything is connected. Plus, there is growing research showing how exposure to artificial light, especially at night, can increase the risk of chronic diseases like diabetes, heart problems, and even cancer. For example, blue light exposure prevents you from getting enough quality sleep, and not getting enough sleep weakens the immune system, making it easier for diseases to develop. Studies have shown that people who work night shifts or are exposed to artificial light at night have a higher risk of developing diabetes. They may also have an increased chance of heart disease and even certain cancers, such as breast cancer. This is because the body doesn't get enough time to repair itself during sleep. In fact, one study found that people who work night shifts have a 40% higher risk of heart disease compared to those who work during the day. Another study found a link between artificial light at night and an increase in breast cancer cases, particularly in women exposed to light during nighttime hours. This happens because artificial light interferes with melatonin production, a hormone that helps fight cancer and keeps the body healthy. Dr. Jack Kruse openly claims that artificial light is one of the biggest contributors to modern health problems.
It turns out when you change the light environment of mammals, since we were sculpted by this gene that only operates with UV light, and if you understand the distillation of what I've said in the beginning of this podcast, subtracting out purple and red light is what MK Ultra effectively found, and that would concentrate blue light, and that basically destroys the photonics and the electronics that are buried in all of us that have a 3.8 billion year history of evolution in all three domains of light. That's prokaryotes, eukaryotes, and archaea. They found out how to destroy how life fundamentally organizes.
However, his ideas are not widely accepted by the mainstream medical community. Some researchers even contradict his theories, arguing that while light plays a role in health, it is not the primary cause of these diseases, and more research is needed to fully understand the connection. But it's a scientifically proven fact that blue light before bed can reduce melatonin by up to 80%, making it take longer for you to fall asleep. Sleep is essential for your body to rest, recover, and function properly. The less sleep you get, the more stressed you may feel, and your body's stress hormone, cortisol, increases. Cortisol is typically highest in the morning, but too much at night can be harmful. It makes your heart race and keeps you alert even when you need to relax. Over time, high cortisol levels can cause issues like chronic stress, weight gain, and difficulty concentrating. This imbalance affects your entire health system, including your immune system, making it harder to fight off illnesses. And this problem isn't limited to adults. Children who are exposed to excessive blue light before bed also struggle with sleep. Studies show that kids who use screens too much before bedtime have trouble falling asleep and are more likely to feel exhausted during the day. This cycle of disrupted sleep and high cortisol levels can lead to long-term problems such as depression, anxiety, and even poor brain development. It's not just about feeling tired. It impacts your brain, body, and mood. And that's exactly what Dr. Kruse has been warning about. But just because of this, he has faced a lot of pushback from traditional health institutions due to his research and public statements. His work, which challenges many long-accepted ideas in medicine, has not been widely accepted by mainstream scientists. He frequently talks about the importance of sunlight and cold exposure for human health. Dr. Kruse believes that modern society's constant use of artificial lights, screens, and temperature-controlled environments disrupts our biology and contributes to disease. This view has upset some health professionals because it goes against the traditional way of thinking about treatment. For example, while most doctors focus on medication, Dr. Kruse advocates for natural approaches like getting more sunlight and cold exposure to heal the body. His strong opinions and unconventional methods have led to disagreements in the medical field, sparking criticism and even attempts to discredit his work. Despite all this, Dr. Kruse has not stopped sharing his ideas. He continues using his platforms, including social media and his blog, to explain his findings and encourage people to take control of their health in ways that don't rely solely on medicine. And if that's not enough, Dr. Kruse believes that artificial light is only the tip of the iceberg. He argues that when people return to natural environments, getting sunlight during the day and experiencing colder temperatures at night, it can drastically improve their overall health. But honestly, how can you stay safe from blue light in the modern world? To reduce blue light exposure, there are several simple strategies that can help. Use blue light blocking glasses, which filter out a large amount of harmful light from screens. These glasses are especially useful in the evening to prevent blue light from interfering with sleep. Install special filters or apps on your devices that reduce blue light emission. Some of these apps adjust the screen's color to a warmer tone, which is less likely to disrupt your circadian rhythm. Change your home's lighting by using dim, warm-colored lights in the evening instead of bright white or LED lights. Make sure to get natural sunlight exposure in the morning to reset your body's internal clock. Studies show that people who get natural light in the morning sleep better at night and feel more energized during the day. Avoid using screens for at least an hour before bedtime. This allows melatonin levels to rise naturally and prepares the body for sleep. Keep your bedroom dark at night because even small amounts of light can confuse your body's clock and affect sleep quality. Your body needs a proper sleep schedule to function optimally, and these small changes can help balance hormones, improve sleep, and boost overall health. And these are not just theories. These strategies have been tested and proven effective. Many people have followed Dr. Kruse's advice and experienced remarkable changes in their health. For example, one person suffering from chronic fatigue reported that after following his strategies, they felt more energetic than they had in years. They changed their diet, spent more time in natural sunlight, and adjusted their sleep habits. Another individual who had persistent pain issues found that by adjusting their daily routine and improving their light exposure, they experienced a significant reduction in discomfort. Dr. Kruse also promotes cold therapy, which involves using cold temperatures to help the body recover and heal. Some people who have tried this, like taking ice baths or cold showers, report feeling less stressed and more mentally focused. Even though these methods might sound unusual, there is science to back them up. Studies show that cold exposure can reduce inflammation, improve circulation, and help muscles recover faster. That's why many athletes use ice baths after intense workouts. Then, there was a software engineer in his 30s who couldn't escape constant migraines and eye strain. Because of his job, he spent hours in front of screens, and it was ruining his health. After discovering Dr. Kruse's research on artificial blue light, he made a few simple changes, wearing blue light blocking glasses, using screen filters, and making sure to get sunlight every morning. Within a few weeks, his migraines stopped, his eye strain was gone, and he felt sharper than ever. Then, there was a college student who had been struggling with terrible insomnia. Her grades were dropping, and she felt exhausted all the time. One day, she read about how blue light could disrupt sleep. She immediately stopped using her phone before bed, switched her room lights to red bulbs, and made a habit of getting outside every morning. Before long, she was sleeping soundly, performing better in class, and actually enjoying college life again. There was also a middle-aged woman who constantly battled brain fog and fatigue after spending hours under fluorescent office lights. She read about Dr. Kruse's research and decided to make small adjustments. She changed her office lighting to softer tones and started stepping outside for breaks. Within weeks, her mental clarity returned, and she finally had energy left at the end of the day. Now, imagine if something as simple as controlling your light exposure could be the key to preventing disease. More scientists are beginning to recognize the crucial role of light in human health. Research has shown that people who get enough natural sunlight during the day have stronger immune systems, lower rates of depression, and reduced risks of obesity and heart disease. This is groundbreaking because it could completely change how we think about public health. Instead of focusing only on diet and exercise, future health advice might include light exposure as a key factor in preventing illness. And here's something even more shocking. Some studies suggest that a lack of sunlight can slow the body's ability to heal, making recovery from injuries and sickness take longer. That's why experts are starting to advocate for light hygiene, a set of habits designed to optimize how much light you get throughout the day. Just like we brush our teeth to prevent cavities or wash our hands to avoid germs, future healthcare recommendations might include managing light exposure to stay healthy. Light hygiene might mean spending time outside, using artificial sunlight lamps in winter, or adjusting screen brightness to protect sleep cycles. This research is leading us toward a future where light is no longer just something we used to see. It's a fundamental part of maintaining good health. Dr. Jack Kruse's insights challenge everything we thought we knew about health. He proves that even small environmental changes can make a huge impact. Could light be the missing key to longevity and well-being? What's your take on Dr. Kruse's research? Drop your thoughts in the comments, and don't forget to like, subscribe, and hit the notification bell for more eye-opening content like this. Share this video with someone who needs to hear this.